Hi everyone. I wanted to talk about something really important today, and that is conduct disorder in children. I recently came across a TikTok video from a mom sharing her experience with her child who has a conduct disorder. She expressed how scared she was for her child to come home because of the danger he posed to himself and others. And unfortunately, placement centers wouldn't take him. This really made me think about how we as a society handle mental health in children, especially when it comes to complex issues like this. So, first things first, what is conduct disorder? Conduct disorder is a psychiatric condition defined by the DSM-5 TR criteria as a pattern of behavior that violates the rights of others or societal norms. It is characterized by persistent and repetitive aggressive behaviors such as bullying, theft, vandalism, deceitfulness, physical altercations. It is also marked by significant impairment in social, academic, or occupational functioning. You might notice that that child is aggressive towards people or animals. They might be bullying, getting into physical fights, being cruel to animals. There is destruction of property, repeatedly damaging things like breaking objects, vandalizing, or starting fires. The child might be telling lies, being dishonest in other ways, breaking important rules, like staying out late when told not to, running away, or skipping school often. So, what are some risk factors for conduct disorder? Number one, the family environment. It plays an important role in the development of conduct disorder. Children raised in families where there is little supervision, inconsistent discipline, or physical abuse are more likely to develop antisocial behaviors. According to a study published in Child Development in 2020, children exposed to domestic violence were found to be more likely to develop behavioral problems, including conduct disorder. This study indicated that exposure to abusive behaviors in early life can lead to internalizing and externalizing behaviors, both of which are linked to conduct disorder. Researchers have also found that children who experience harsh punishment and lack positive parental engagement are at a high risk for developing conduct problems. They concluded that parenting styles that include neglect, inconsistent discipline, and emotional maltreatment were significant contributors to conduct disorder. And this in children. This study was done by Jeffy et al. In 2021. Peer influence to plays a significant role in the development of conduct disorder, especially during adolescence. Adolescents who associate with peers who engage in antisocial or delicate behaviors are more likely to adopt similar behaviors. Studies have shown that peer relationships are a critical factor in the development of conduct disorder. Children and adolescents who associate with delicate peers are at a high risk for developing antisocial behavior, as they may adopt maladaptive coping strategies and behaviors that can lead to conflict with authority figures and peers. Parental mental health issues is another one. Research shows that parental mental health issues, particularly mood disorders like depression and personality disorders, can increase the likelihood of a child developing conduct disorder. A study published in the JAMA Psychiatry in 2020 highlighted that children of parents with psychiatric disorders are at a high risk for emotional and behavioral problems, including conduct disorder. Specifically, parents with antisocial personality disorder or substance use disorders are more likely to have children who develop conduct disorder, and this study was by Pine et al. In 2020. A meta-analysis in Psychology Bulletin in 2019 found that children exposed to parental mental health issues such as major depressive disorder or antisocial personality disorder had a higher risk of developing conduct disorder. This is due to a combination of genetic predisposition and environmental factors like inconsistent parenting and emotional neglect. Socioeconomic stressors too is another one. Poverty, lack of access to quality education, instability in housing, they have been strongly associated with the development of conduct disorder. Children from low income families often face heightened stress, fewer opportunities, and a greater likelihood of exposure to trauma. A study published in the Lancet Psychiatry in 2021 found that children raised in poverty stricken environments were more likely to experience mental health challenges, including conduct disorder, due to the strain placed on families and the lack of social resources. So how can we support children with conduct disorder? If your child is diagnosed with conduct disorder, early intervention is key. So here are some ways to support that child. Number one, foster positive family relationships, open communication, consistent reinforcement. Quality family time can strengthen the parent-child bond and reduce the risk of behavioral issues. Number two, set clear rules and be consistent. Children with conduct disorder need clear boundaries and consistent consequences. Make sure that child understand the rules and provide positive rewards for good behavior. Number three, encourage empathy and healthy social skills. Help your child develop empathy by engaging in activities like volunteering. Social skills training can teach them how to interact positively with others. Another important one is to seek early mental health support. Don't hesitate to seek help if you notice troubling behaviors. Early therapy or counseling can prevent escalation of the behaviors. Another one is to provide positive role models for your child. Surround your child with others who demonstrate healthy behaviors and good coping strategies. Positive role models are essential for teaching your child how to handle challenges. Another important one is to limit violent media. Reduce your child's exposure to violent or aggressive media content, as it can encourage harmful behaviors. Another one, create a structured routine. A predictable daily routine helps children feel secure and understand what is expected of them. You might also need to address other mental health issues that a child might be facing, maybe ADHD, depression, anxiety. Parents of children with conduct disorder, they might feel blamed or judged, often leading to guilt or frustration. Healthcare providers should ensure that they do not place blame on the parent, as conduct disorder is often linked to multiple factors, including genetics, environment, social influences. So as healthcare providers, we need to listen actively to these parents, allow them to share their experiences and feelings, frustrations, without interrupting or judging. Let them express themselves openly. Normalize their experience. Let them know that they are not alone. Acknowledge how difficult it can be to manage your child's behavior, especially when faced with societal stigma or misunderstanding about the disorder. It is not easy to manage conduct disorder, but with early intervention and the right support, children with conduct disorder can learn to improve their behavior and form positive relationships. As parent, your involvement in seeking guidance and helping your child is important in supporting their emotional and mental growth. Remember to work with a mental health provider who can guide you and your child through the challenges of conduct disorder. Early intervention and professional support are key to helping your child to thrive. If you're going through this, please remember that you're not alone. There are resources and support systems to help you. Thank you so much for watching. My name is Dr. Georgette. See you in the next video.